Hello, everyone, and welcome to another amazing session of Ask Dr. Dansinger. Since it is American Heart Month, we are going to be focusing today on diabetes and the connection with heart disease. It's really important with more than half of Americans literally either pre-diabetic or fully diabetic, either type 1, type 2, mainly type 2, and not doing anything about it, not changing their lifestyle quick enough. Even one sugar molecule. Dr. Dansinger is going to talk about how it can damage your arteries, leading to plaque buildup, putting you at risk of losing a limb and losing your life. So this is really life and limb saving information that you are going to hear during this episode. Welcome, Dr. Michael Dansinger. We really appreciate you being here. And if people want to follow Dr. Dansinger, make sure you go to his YouTube channel. And it is the @ Michael Dansinger, MD. So it's youtube.com/@ Michael Dansinger, MD. So make sure to like this video and subscribe to his channel. And you can also like the video on our channel as well. Let's subscribe to youtube.com/@ The Way to My Heart. But great information ahead. Dr. Dansinger, welcome and thank you so much for donating your time.
Thank you, Kim. It's great to be here. So it's February. That makes it Heart Month. And heart disease is the leading killer of American men and women, and it's the leading cause of death around the world. And so February is just a reminder of how important heart health is. And I love talking about heart health.
Fantastic. And one of the greatest risk factors for heart attack is diabetes.
Oh, absolutely. So people with diabetes, type 1 or type 2 diabetes, have 2 to 4 times. So let's call it triple the risk of early coronary artery disease, heart disease, and an increased risk of stroke and peripheral vascular disease. And diabetes wreaks havoc on the artery. If you have diabetes and your blood sugar is high, then that's fueling cholesterol deposits in the arteries. So yes, glucose molecules, you can think of them, almost imagine them as like being sharp, like shards of glass scraping away at the lining of our arteries. And that leads to plaque deposits and heart attacks in the future.
Yeah, there are two ways, right? In which the plaque goes in there. Either one, you can get those small, dense LDL particles that can eke into the damaged areas of the wall and push that wall out, or you have the ones that can they're sticky, right? And they can stick to those damaged areas, the inflamed areas that your body says, oh my gosh, here comes the sirens. We need to go in and we need to go and attack this damage and patch it up.
Yeah, that's right. So atherosclerosis is a vicious cycle of cholesterol deposits and inflammation. Both fuel one the other. And so, yeah, you imagine the little tiny microscopic cuts in the artery lining caused by glucose or damage to the cells endothelial lining of the arteries gets damaged by high blood sugar in a variety of ways, and that leaves openings for cholesterol particles to slip in there, especially the small, dense, sticky cholesterol particles. Small, dense LDL particles are the ones that get into the cracks and into the scrapes, and they start to build up. And then you get inflammatory cells, white blood cells, that come in to try to clean up the damage, but sometimes they do more harm than good when you've got inflammation in your arteries, and then more cholesterol plaque sticks in there and more inflammation, and pretty soon you've got something that is stiffening the arteries and raising risk for heart attacks, strokes, and peripheral artery disease.
And but it's interesting. Someone asked me this earlier today. Um, are there areas in the body that are more susceptible to this damage by sugar molecules? And I know from my experience, we always hear about below the knees and we hear about the heart, but we don't hear much else in terms of the diabetic impact. on vascular health other than those two areas. But I assume it's all throughout the body because it's the human superhighway.
I think it's best to think about the damage as being everywhere in the body, and you do get it in patches, but you get patches of damage throughout the body. And so some areas that are seem to be especially prominent are the heart, the coronary arteries of the heart, the carotid arteries in the neck can be especially affected, the um, uh, the lower extremities can be,
Yeah,
whether
below
it's
the
in
knee
the
and into the foot,
groin
especially.
area or behind the knee or in the foot. And then there's organ damage. So the kidneys are especially vulnerable to the negative effects of diabetes. So high blood sugar damages the kidney organ itself, making it more, less able to do its job, which is to make urine and to clean the blood. And the kidneys can get blockages in the large arteries, the renal arteries too, and so that can be a cause of primary hypertension. So the eyes are another especially vulnerable area, and so when it's recommended that people with diabetes go to the eye doctor once a year minimum just to get a check, and they look at the eye, especially the retina, and they can see blood vessels. They can see how normal or abnormal the blood vessels are in the back of the eye in the retina, which is sort of like a way to assess the blood vessels throughout the body. And so when a person has diabetic retinopathy, that's damage in those arteries in the retina, and that can signal artery damage throughout the body.
And too much sugar in the blood can make the blood very thick and very sticky, and it makes it really tough to get through some of those smaller vessels. So when we tell people who have blocked arteries in the legs that they need to walk, walk, walk and grow those collateral vessels, the problem that they have is that the blood is too thick and sticky to get through those smaller collateral vessels to actually improve their symptoms.
Yes, that is a very important point, Kim, about the thickness of the blood when you have high blood sugar, and it affects the clotting of the blood in a few different ways. And so one way to think of it is the sugar level in the blood is so high that it's just, thickening the blood. But the bigger effect is really on the production of the coagulation factors in the blood, the proteins in the blood that have to do with, um, how easily the blood clots. You don't want your blood to be very clottable. You want your blood to be fluid, not thick. And so the liver is where the blood clotting factors are made. When you have high blood sugar, it affects the liver's ability to, create the right balance of proteins in the blood, and you end up with um, abnormalities to the clotting, and it's a problem. It raises the risk of heart attacks. And so controlling the blood sugar and eating healthy food that's recommended for diabetes reversal is an important way to help keep your blood flowing and nice and fluid and not thick.
Yeah, and that's why you always hear a lot about diabetic neuropathy because, those are really the small vessels that feed the nerves. And if your blood is too thick and sticky, well, your nerves aren't going to get enough blood flow because it's got to be thin enough to get all the way up to those nerve endings, or else they're going to start screaming and going, "Hey, we're not getting enough blood flow," and that could lead to long-term damage of those nerves.
Yeah, that's right. So the nerves, especially in the feet, the longer the nerve, the more it's affected by high blood sugar and diabetes. And so those nerves that go to the toes are some of the longest ones in the body. And so that's why diabetic neuropathy often affects the toes first. And glucose, high blood sugar levels damage the nerves directly. Also, as you point out, it affects how well the blood is flowing to the nerves. And so nerves get nourished by blood and oxygen in the capillaries throughout the body. And so if the blood cells aren't flowing freely, they can't get into the capillaries and the nerves feel the damage.
And as we've discussed, one sugar molecule can make or break you. I mean, just one additional sugar molecule can end up wreaking havoc on your body. But we still have a lot of patients that will hear from their doctors, "Oh, it's great. Your A1C is at a 6. You're doing fine." And I get that if they were at a 13 prior, a 6 is definitely much better. But that doesn't mean you're in the clear. You still, at a 6, have sugar molecules that are wreaking havoc on your body.
Yes, that's a really good way to think about it, Kim. Yeah, so even people without diabetes with normal blood sugar are still at risk for America's leading killer because um, there's still sugar in the blood, and we need sugar in the blood, for energy, but we don't want high blood sugar spikes after meal. Even people without diabetes can get high blood sugar spikes after a meal, after eating an especially starchy meal or the combination of lots of starch and sugar and animal fat in the same meal can cause blood sugar spikes even in people without diabetes. And then other risk factors for heart disease like high blood pressure and high cholesterol in um, inflammation and ultra processed food all combine to, and smoking of course, and lack of exercise, and all combine to you know cause wear and tear on the arteries and on the heart.
Does the A1C vary in terms of its normality depending on patients, patient to patient? Or is there pretty much a standard where we should strive to be where we're in a little bit more of the safe zone?
Yeah, so the hemoglobin A1C is a pretty good measure from person to person, with a few exceptions. But for the most part, diabetes, we say diabetes starts at a hemoglobin A1C of 6.5%. And if you're at 6.5%, you've got risk, much higher risk than if you're in the pre-diabetes range, which is an A1C of 5.7 to 6.4. So if your A1C is not in the pre-diabetes range, if it's 5.6 or less, that's pretty good. And it's hard to point to a study that shows that, 5.6 is, particularly worse than 5.4 or something like that. But if you're 5.6, you're right next to prediabetes. And so it's something to be aware of. But the real damage is happening when the A1C is above 7. And so there's a very big difference between an A1C of 8 versus 6, for example. And so I'd be especially alarmed anytime the A1C is 7 or higher.
Yeah, no, definitely. I know for my dad, it was interesting. There's a difference between sometimes a general MD versus a functional medicine practitioner. The functional medicine practitioner, for example, with my dad, he was told he needed to be at a 5.7 by his primary care, and then his functional medicine practitioner says, "Oh no, I want you at a 5. I want you at a 5.2 or lower." And so he was like, "Shoot, I got a long way to go." He made it, but it was a lot of work. It's tough to reverse those lifelong habits that you have.
Yeah, absolutely. If just to elaborate a little bit on the point you're making about, when it comes to A1C is lower better. So yeah, absolutely lower is better. However, the research points to the idea that um, you can use drugs, medications to lower the A1C um, all the way down to 7. But once you're below 7, there's not much benefit to piling on additional drugs. The research does not support much health benefit for using drugs to push the A1C much lower than 7. However, when you use lifestyle to push the A1C below 7, I think that's when is more likely to get a payoff. And so, using three drugs to get the A1C down to 6 is not what is usually done. I think it's very important because drugs have, all drugs have pluses and minuses at the same time. They're a mixed bag. And I believe in drugs to treat diabetes, but I've committed my career to helping people get their diabetes fully reversed, which means they no longer need drugs to have normal blood sugar. And the it's very important to try to get the A1C below 7, but you have to use lifestyle, eating and exercise and other lifestyle ways to get healthier. Um, so that's how I like to get the A1C below 6.
I love that you're saying that because I had a very well-known, how do I call it, a thought leader in medical, highly regarded, who said to me the other day, well, I'm really hoping that the GLP-1s are going to make the biggest difference on preventing peripheral artery disease and amputations. And I said, really? We're just going to rely upon the drugs. That's what we're going to do. And I think that that's a wrong way of thinking because we're teaching people to pop a pill versus actually taking responsibility for their health and their life and their limb. So many of our patients will say, well, I'm taking my drug and I'm doing my injections, and so I don't need to watch my weight. And in fact, there's a commercial for Medtronic's Libre, the Libre, the patch, where the guy is out to dinner and they're talking about, oh, it's unknown, and he's looking at his menu and he doesn't know what he's going to get. So he presses on his little Libre, his device, and he says, oh, I basically can get whatever I want because my blood sugar is normal. So you see him come out with this big hamburger and French fries or whatever he had because he was okay to eat the wrong thing because his blood sugar monitor said that it was okay. I don't think that that's correct. That's my own personal opinion. It might get people started, but I like what you're thinking is to say, hey, the drugs are going to get you started. They're not the holy grail. They're going to get you to the point, but you still have to take responsibility for changing your habits to get you the last mile.
I
Off
agree.
my
So
soapbox.
I am a big believer in the medications, and I am a fan of the GLP-1 drugs. And many of my patients have been prescribed those drugs by other doctors, and I'm supportive of that. But I agree with what you're saying. We're never off the hook. We have to eat healthily, whether we like it or not. We pay the consequences if we do not eat
Mhm.
healthily and stay physically active. And so drugs are secondary to lifestyle. Lifestyle is the primary way to prevent and reverse disease. We use medications when needed as an adjunct to lifestyle, but type 2 diabetes and heart disease and peripheral vascular disease, these are lifestyle diseases. And the primary way to prevent and reverse these things is lifestyle. And we use drugs because they help, but they are not the ultimate solution. It's about lifestyle. And a lot of the advantages of lifestyle are not quite visible either. And so we benefit from them even even when we're on cholesterol medication, even when our blood sugar is controlled by diabetes or blood pressure medication, we still benefit from eating right and exercising.
Now, we can still cheat once in a while. I mean, come on. Do you have a schedule for your patients? You have a diabetes reversal program. So those people who are in Massachusetts, New Hampshire, or Florida, Dr. Dansinger and his diabetes reversal program, they're actually covered by Medicare and Medicare Advantage plans that are PPOs. So they're really worth checking into, and he is available. And his program is very powerful and has helped several of our patients reverse their diabetes in a really fun, engaging way that you get that personal attention, that one-on-one attention with our friend Dr. Dansinger. But you allow your patients to cheat. Do you create a cheat schedule for them that says, okay, we're going to give you a little leniency here or there? I get these are your non-negotiables, and we're going to work around those.
So great point. So Kim, thanks for the shout out. Yes, I work with patients in those states, Massachusetts, New Hampshire, and Florida, who have Medicare or Medicare Advantage PPO. And so insurance covers that. And in my program, I believe I advocate the 90% rule. You should be eating healthily, 90% or more of what you're eating should be, on healthy food according to whatever eating strategy you're following. But living life to the fullest means enjoying some treats once in a while. And so for every individual, they need to find the right balance. I'm not going to tell them whether they can eat this, that, or the other, which of the unhealthy treats
Yeah.
they can decide, and it's very personal. And so for some people it's ice cream, some people it's candy, for some people it's, white bread, but it it's it's very challenging for most people to be 90% adherent to a serious eating strategy. And so I help them figure out how to find balance and how to navigate the gray zone.
And I want to drive home the point that, if their sugar molecules have wreaked havoc on their arteries in either their legs or their heart, and the doctor says, okay, it's time for a leg catheterization or a heart catheterization to do a little roto rooting of those arteries, whether the legs or the heart, you have to know that if your blood is really thick, your A1C is not under control, it's just going to clot right back up following those procedures. So it's more important than ever to start now before you have a procedure, unless you end up with an acute situation. You don't want that. But if you have time, it's always best to make sure you can get that A1C under control sooner rather than later, especially prior to any catheterization, because that blood with those sugar molecules in there, as Dr. Dansinger was mentioning, makes your blood thick, sticky. And if there's extra inflammation where the doctor has treated your arteries, what do you think is going to happen? It's going to stick right there to those areas that the doctor just treated, and you're going to be back to square one before you know it.
Very important point, Kim. Yes. And I've had the privilege of working with some of the patients you've referred to me. You've been able to see how quickly some people can turn around the hemoglobin A1C and the proper thickness and blood flow of their blood. So yes, just a few weeks or months of lifestyle coaching can really make a dramatic difference that you've seen in the catheterization patients.
Yep. And so, in our last few moments here, any final thoughts on the deadly connection between diabetes and heart disease, especially during American Heart Month? It's a really important message.
Yeah, type 2 diabetes and type 1 diabetes, triple the risk of heart disease. And that risk is really tied to the extent to which your blood sugar is controlled. And so someone with well-controlled diabetes has a lower risk of heart disease than someone who has poorly controlled diabetes. And so when we say it triples the risk, really it triples the risk in the typical average patient, but it does not triple the risk in someone with well-controlled diabetes, but it much more than triples the risk in someone with poorly controlled diabetes. And so diabetes is a big risk factor, but there's a lot that we can do to mitigate that risk. And so that'll be my closing thought at the beginning of